Hello, everybody, and thank you for spending some time with us this morning or afternoon, depending on where you are. My name is Tony Peterson, and I'm the Vice President of Business Development here at Next Trust Bill Flash. And I am joined on the call today with Jacqueline Martinez, who is our Relationship Development Manager here. We will be providing you the presentation today. We each have a couple of different roles to play. I will be your host for today, managing the discussion, answering the questions that you have. Jacqueline will be monitoring the questions that you may be having during the presentation. And what we would like to ask you to do is to enter those into the GoToWebinar interface that you have there on your screen. There is a question section. If as we're doing our presentation, you have any questions, you can feel free to type them in there. And if Jacqueline can answer them on her own, she'll do that in a way that everybody has the ability to see. And there will be some of them that at the end of the presentation, we will have her read out, and I can answer them verbally as well if there's any that we need to address in that manner. Without any further ado, we will jump into the presentation. Today, we're going to be talking about improving the patient digital experience. Because at Bill Flash, you can see up on the screen under our logo, our tagline is getting you paid. Ultimately, the way that we get you paid is making sure that we're offering the patients methods and platforms that they are more likely to use in order to make a payment, and communicating with them and interacting with them in a manner that will entice them or lead them to make the decision that says, I'm going to pay this bill that came from my visit to your practice. And so if we focus on improving the experience that the patient has, that's what's going to help us lead to the outcome of getting you paid and having a higher rate of patient reimbursement. So this topic is something that is very important to us. It should be very important to you, and hopefully you get some good information out of it. I will also say that as with any presentation, each of you have your own workflows, your own processes, your own needs. There may be things in here that apply to you, and we would ask you to look for those, pull out the pieces that are good and utilize those. There may be things that have nothing to do with your business, and you don't even need to worry about those. So I think it's important as we approach this particular topic, because there's so many different layers and levels of expertise or tech savviness that patients might have, that we don't try to use a one-size-fits-all approach. There's different strategies that you can use to reach out and interact and interface with different types of patients. So think about how you can utilize the strategies we talk about today to specifically reach out to the patients, the types of patients that are coming to your practices or interacting with the practices that you serve, if you are a billing service. So what is it that we're going to cover today? Let's see if I can get my screen to advance the way that I would like it to. First, we want to go through some of the reasons why a good digital experience for patients should be a top priority for you and your practice. It's a tough thing to have that conversation, because we know that most medical practices want to focus, and they should put the majority of their attention and care on providing care to the patients that are coming in. Part of that, though, in providing the care is making sure that those patients understand and receive their bills and are likely to pay it. So it's very important that we're providing those patients a good digital experience, and we need you to look at it that way. We also believe that it's important to make it easier to pay for your patients by reducing the barriers that might be there for them making the payment. Some of those barriers are very apparent. Some of them are things that we might not have thought through or hadn't considered a different approach in order to attack the problem at hand. So we will talk through some of those barriers and how to make it easier to pay by reducing them. And then we will go into some tools that can improve the digital experience that your patients are going to have. So what is it that your patients want? If you really break it down, they're looking for a seamless digital experience. It seems that overnight, the whole world transitioned from no smartphones to smartphones about a decade ago, and it completely changed the way that we interact with each other, with the world, with businesses, and it changed how we view and make decisions about where we spend our money and how we approach the different decisions that we make as people, as patients, in our day-to-day routines. What's really interesting is that for a long time, patients chose their doctors strictly based off of relationships. They knew their doctor. They went there because they felt like their doctor knew them. And there's, to some extent, still a large number of patients that would remain loyal to a doctor or a practice simply out of familiarity. They want to work with somebody that they know and they trust. I don't think that that's going to all go away. But what I found fascinating with the data that we have found here, and we have the URL for the source of this data that we'll include in the presentation when we send it out. But it's very interesting to me that 1 in 5, a little more than 1 in 5, 22% of patients who consider themselves loyal to their current physician, this is not 1 in 5 of all patients, but this is out of those who said, I'm loyal to my current physician, 1 out of 5 would switch to a different office that provided better digital communication tools. That's a staggering number to me. That means that 1 out of every 5 patients who says, you know what, I really like my doctor, I trust him, I want to stay there, but they just don't have a way for me to interact with them the way that I would like to online or digitally, I'm going to leave. I'll go consider somebody else that gives me the more integrated and easy experience. 54% of all patients in the survey stated that they are interested in monitoring their medical payments online. This is not saying 54% of them want to monitor their lab results. We all know that they want to be able to get their lab results and other items directly related to care online. But over half of all patients are saying, I want to be able to view and monitor the payments that I'm making to a medical practice through an online portal. This has really, I believe, changed and increased, become a lot more apparent during the pandemic. People have gotten used to having digital options wherever they go. They don't want to go back to doing everything manually or the way that they were before. They're willing to go find someone who is going to go out and make that check-in process and making payments, that entire process easier for them, more streamlined, something that they don't have to think about as much. So what does it mean to give them a painless payment experience? Well, one of the first things that we want you to pay attention to is if you make it easy for the patient to pay, the less they're going to have to think about it, the better. So what does the better mean? Ultimately, it means that it's more likely that the patient is going to pay that bill because you've made it easy for them to do that. If the only way for them to pay is by writing a check and mailing it in, or bringing a check to the office, or paying the next time they come in, they're going to choose the option that is usually most easy, or in many circumstances, they're going to try to delay the payment as long as they can. If you make it easier for them to do so, they don't have to think about it. They're going to be far more likely to do it. Patients are also acting more like consumers, and what consumers want is convenience. They want the ability to take care of something as in their busy lives while they're on their phones, very quickly and easily be able to pay a bill that shows up. They don't want to have to delay that, think about it too long, or go through a lot of hoops in order to make the payment or interact with you in your practice. They really want to find the most convenient options. But they also, moving on to the next point, are very conscious of the security risks that exist in today's world. We've seen it over the last few months with a lot of the different cyber attacks that have occurred throughout the country. One that affected where I live here in Atlanta very closely, that shut down the pipeline for gasoline that's at the East Coast. It had a very real impact on the lives of patients, doctors, everybody up and down the East Coast. So it's important for them to understand that their data is secure. So we need to offer them a quick and easy to use manner of making their payment, or options to make that payment. But in their mind, they have to feel comfortable that they're not compromising either their practice or the data of their patients. So it's important that we think about and present options that solve both of those issues. We also, I believe that one of the biggest barriers that we have to a painless payment experience with our patients is that we're not very good at making sure that patients are aware of the different options they may have up front. If the patient shows up for a visit and is sitting in the waiting room, that is the time to present the options for payment to the patient. Most practices are thinking about that after the visit has occurred, but we need to change our processes and make sure that the patients know, I can do an automated payment, for example. I can do a planned payment, and we need to be able to walk them through how they could do something like that. If we don't talk to the patient and we have that service available, the patient's not going to know about it. They won't sign up for it. And ultimately, you're not going to get paid as often when the patient doesn't know what those options are. So it's important that we have a communication strategy that lets the patients know, hey, we are able to process an automated payment for you. How can we do that? We'll talk about that a little bit more later on in the presentation today. So what are some tools that will improve the digital experience for your patient? Some of these will be things that most of you have implemented. Some of them may be things that you haven't thought of. First, appointment and payment reminders. It's critical that we communicate with patients where they're already at, their phones. These patients are on their phones all day long. If they're younger, it could be higher. Older people might not be on it quite as often, but I believe that the days of people not being able to interact with the internet or with computers utilizing a device that fits in their pocket are long gone. So if that's where those patients are, that's where we need to be communicating with them. We need to utilize options like texting and email to notify them of the options that they have. And BillFlash has options that can offer that to all of your patients. Whether you're an existing customer of BillFlash who doesn't know that you could send a text asking for payment, or a new customer that's looking for something like that. These are features that if you aren't offering those, if you're not delivering a statement notification to a patient via text, you're communicating with them on a platform that they're not looking at. It would be like buying ad space on AM radio right now. And there may be a few people here and there that are listening to it, but by and large, that's not where you're going to reach the masses. You need to be communicating with them and reaching out to them where their eyes are and what they're looking at on a daily basis, on an hourly basis, and in some cases, every minute. We also need to make sure that we're giving them an easy way to confirm appointments and make those payments without having to speak to anybody. If they have to talk to somebody, then very often they're going to choose not to make that call. Now, I also have run into many different circumstances where we're doing a presentation like this and we talk to people such as you, those of you that are on the call, or people like me, and we say, well, I want to talk to someone, I'm going to. That may be true, but we are not the same as most of the people that are out there right now. There is a very real aversion among a large segment of the population to either picking up a phone or answering the phone. I think that the spam phone calls have really damaged that platform as a communication platform. So it's important that you're giving these patients the ability to do what they need to do very easily without having to speak to anybody. I also believe that setting up automated payments is one of the best things that you could do for your practice. What are automated payments? Well, it's exactly what it sounds like. If somebody has a utility bill, for example, every utility company that I have interacted with in my life has an option that they push out almost on every single bill and in every single interaction, sign up for automated payments. Now, a utility bill is not always static. A lot of times when we speak with medical practices, they'll say, I can't sign up my patients for an automated payment process because we don't know what the bill is at the time that they're signing up. Well, utility customers don't know what their power bill's going to be until they have usage. Now, they have control over it to some extent by what it is that they consume, but they don't know how much their electric bill is going to be in most circumstances until the bill shows up. Yet there's still a sizable portion of the population that's willing to sign up for the automated payment program with each of those utilities. Now, in our survey, 43% of patients stated they're interested in signing up for automated payments. 43 is not 100%. It's not even 50%. It's not half. But if you think about what that means, if we had an automated payment process in place with your practice, the way that it's built with BillFlash, when you send out your statements, if 43% of those statements were paid the day that you sent those out, that would allow you and your staff to not worry about going and collecting on the payments from that portion of your patient population, and it will free up the time necessary for you to focus on the other 57% who don't sign up for automated payments. It reduces the workload by automating the patients who are willing and able and sign up to be part of that automated process. So to a patient, the benefits are easy. It simplifies the payment process so they don't have to think about it. You don't want them to have to make a decision every time they're going to pay you in your practice. You want it to be easy. You want it to be something that they just do. They also understand that using a system like this with the different tokenization and encryption and communication security protocols that are in place make it more safe and secure than writing your credit card down on a piece of paper and mailing it through the mail back to the practice. It's a whole lot easier for a patient to maintain safety and security when they use tools that have that integrated with it. There's a huge number of benefits to the practice, but the two that we really want to focus on is it's really a simple, easy way to ensure that the practice is paid in full and on time in as many circumstances as possible. We're never going to get 100% of our patients to pay their bills. That's a dream that could not happen in most circumstances. But we can make sure that that number is as high as possible. We need it to approach 100%. It also is going to give you the ability to control which payments are automated and how much is withdrawn each month. The way that that's done is that you can set a maximum payment amount for each patient. So that means if they receive a bill that is, if their maximum was $100, they receive a bill for $75 instead of a bill, we'll charge them, send them a receipt, and that payment is done. The patient hasn't had to think about it. If the threshold was set at 100 and they got a statement or a bill for 150, we would automatically charge them the 100 and they'd receive a statement for the remaining $50. You make it very easy for that 43% of your patients who would sign up in an automated payment program to do so. I also want to stress, and we will talk about this a little bit more later on, but I need you to start thinking about it as you're processing the data that we're sharing with you today. Just having the ability to do automated payments is great and wonderful. However, the point in time where you need to ask the patients to enroll in automated payments, in most circumstances, needs to be before the visit. If you have that conversation after the patient has already received the services that they require from your practice, the likelihood that they sign up for something like this decreases, because at that point in time, they have what they need from you, and you are to some extent at the mercy of when they decide to make the payment for the services that you've rendered. You really want to find a way to get them and encourage them, entice them, figure out how to get them to sign up for automated payments before the visit. You also want to give patients flexible online payment options. Most patients pay for goods and services online, and they're looking for similar options in healthcare. It often feels like in healthcare, we are some of the last to adopt some of the different technologies that are out there. I'm still surprised at the number of doctors that are still utilizing paper charts. I know that the number is decreasing, but compared to other industries, I believe that healthcare really is often a laggard in adopting technology, and there's a lot of reasons for that. But that's not what our patients are looking for. They're looking for ways to pay for goods and services online, and that's why the number that we're willing to look for a different option will do so. They expect to have the same level of service and the same convenience within healthcare that they experience in the other interactions and financial transactions that they have in their life. So the benefits to a patient, if you're giving them ways that they can make their payments online, they can pay at any time, including before the visit starts, or when they receive their statement while they're walking through the grocery store. They get their bill on their phone, they can go easily pay it, and they're done. It doesn't have to be a task that they go write a check when they get home. It can be taken care of right then and there if they want to do that, and if you have given them an easy way to do so. It also gives them a far easier and more automated way to monitor their billing and payment activity on their own. If they can monitor the payments that they're making to you, track them, get a record of what their history is, that means that they're not going to have to call your billing office in order to get some of those questions answered. They can do a self-service lookup, and that's what most of them are looking to do. The benefits to a practice: if a patient goes and puts in the payment online, it can reduce the manual work and calls to the office. The amount of data entry that you have to do if the patient pays online using a bill flash payment option that is integrated into your EHR or practice management system can greatly reduce the amount of data entry that you have to do when a patient makes a payment on those payments that are made online. It also ensures that you get paid sooner and more often. So if the patient that we were talking about just a second ago that's walking through the grocery store and a statement or a bill pops up on their phone and they pay it right then and there, you don't have to wait for them to go somewhere else and make that decision. They're doing it immediately. So that's how this is going to get you paid sooner and more often, but it's not going to happen if you're not utilizing the technology in order to communicate with them and give them the option to make that happen. Payment plans. Healthcare is crazy expensive in the United States. It costs a lot of money, and patients, right now, there's a lot of people who are struggling from a financial perspective. We need to offer options that make it more likely that they're going to pay part or all of their bill. When a patient receives a bill for $1,000, and in their mind, there's no way they can pay that $1,000, most of them don't sit down and think, okay, well, maybe I'll pay what I can pay. I'll pay my $50 or $100 or $20. And the net effect of that type of a collection effort is that that patient who owes $1,000 is either going to pay $1,000 or they're going to pay $0. What's interesting is that if you offer a payment plan, it makes it more likely that the patient says, oh, I can figure out a way to make this happen. And 90% of patients who are put onto payment plans plan to pay their bill in full if they're given flexible payment options. Now, that doesn't mean that all of them are going to. There's always going to be patients that try to figure out how to not to pay their bill. That's just part of working with the public. But 90% of them say their intention is to pay their entire bill if they're given that option. If they don't have that option, if it's 1,000 or zero, and they don't know how to pay that 1,000, they're going to pay zero. It removes one of the biggest barriers to payment, which is financial hardship and cash flow issues that the patients are experiencing in their own life and their own budget. It's a win-win situation where both the patient and the practice get what they want. And if you utilize the options that come to automate those payment plans using the Bill Flash Pay services, you don't even have to remember to run the payment on a monthly basis. The patient's credit card is authorized, and the transactions are scheduled and automated so that on the first of each month or any day of the month that you choose, they're automatically processed. And the only time that it doesn't work is if the patient's card does not have sufficient funds in order to fund the transaction, or if the card is expired. So in those circumstances, you can handle those as an exception, and we have a process to do so, but it's not something that you have to remember to have your staff run. Okay, we're going to go run all of the people who've agreed to a payment plan this month. No, you just sign them up, automate it, and manage the exceptions. That is a win-win solution if I've ever heard of one. It is absolutely critical that as we are making our efforts to collect on the services that we have provided to our patients, that we have to communicate with patients. We need to make sure that patients are aware of the payment options before the visit begins. This is what we talked about a little bit earlier. We need to encourage patients to choose one of those options, sign up for one of those options at the point where they're checking in. If you wait until they're checking out, they're going to say, mail me a statement and I'll pay you when I get it. And the reason that they ask for that is because they know that if you mail them a statement, that it takes longer for that statement to show up in their mailbox. If it takes longer for the statement to show up, that means that it's longer before they have to think about paying or fund that transaction. So they're going to try to delay in many circumstances. If you catch them prior to check-in and require or encourage, incentivize, figure out how it is that you're going to get them to make that choice prior to that visit, they're going to actually, in more circumstances, be more willing to make that option, which will make it the job of your staff, your practice, your business, your billers far more easy. Now, most of the practices that we've talked to about this, spoken with, they'll share with us that their process prior to the visit includes the intake forms, whether they're digital or paper forms that you hand to the patient on a clipboard or a pad. There's a lot of different options that are out there to handle that. But most of them will say, well, I include my financial policy and I make the patient sign my financial policy prior to the visit. Well, the financial policy is great, and you are absolutely covering your bases from a legal perspective. And when the patient doesn't pay, you have everything you need to go after them and get a judgment against them. And all of that costs time and money and makes it not only less likely that you're ever really going to see that money, but it makes it less profitable for you to bring that money in. If you are trying to go through all of that at that point, you really aren't making the same amount of money as if the patient just is more likely and makes the payment without having to do so. So what I have up there on the right side of the screen is a sample of a financial policy. This isn't one that I would expect anybody takes and uses verbatim, that you just, this is the world's greatest financial policy form. I just want to provide you with the context of what this could look like. And I am sure that you will find better, more interesting, more effective ways to communicate with your individual groups of patients than I may have shown here. But I want you to take a look. The top portion all the way through where the section where it says unpaid balances is what most people's financial policy forms look like in some form or another. Yours might be more complex. It might be less complex, different wording, but generally speaking, you're telling the patient that we're going to bill your insurance and you're responsible for any balance afterwards, and that we can, if you have anything that is required, you're communicating that with them there. What I don't see very often at this point in the communication is this last little section down here at the bottom, further payment options. In addition to accepting cash card and checks at check-in, we also offer several other convenient, flexible payment methods. Please check the options below you would like to use if applicable. At that point in time, you can ask them or incentivize them by sign up for automatic payments and save 5% on your bill, or we will give you a free mug if you sign up for automated payments. You need to make sure that you're staying within the laws and the contracts that you have as far as what it is that you're able to offer to a patient there. I recognize that there's different rules depending on the plans that you're participating in, but the point is that you're finding ways to incentivize and drive your patients to utilize these electronic options at the point in time where they're most likely to sign up for it because they need something from you. This particular form is one that we have attached to the presentation, and we will be sending it out to all of the attendees once the presentation is finished. So if we move on from how to communicate with patients, we're almost done. I think that I've got 2 more slides here. It's important that you recognize that you need a system or a solution that will allow you to facilitate and do all of these things. And BillFlash combined with My Provider Link has the ability to offer all of these different options to you in a manner and a form that can integrate with your EHR practice management system. The level of integration varies based on the system that you're using. Some of them are a lot more deeply integrated. Some of them are a little less integrated, but we have integration with over 150 different EHR or practice management systems. So utilizing BillFlash can give you the ability to accept online pre-visit payments from the patient. We can give you the ability to accept in-office payments that integrate with the platform where the patient can self-serve and see all of their payments. We will provide you a platform where you can deliver statement notifications that are secure and HIPAA compliant to your patients via text or email platforms. I want to make sure that the HIPAA compliant nature of those is absolutely clear. We are not sending the actual statements via email or text. We're sending a notification that says you have a statement that is available from Tony's practice. Click here to view it or pay it, because HIPAA laws require that you encrypt and secure that data, and we wouldn't want to deliver the PHI through a platform or a method that was not HIPAA compliant. So, but we offer the ability for you to deliver those notices in that manner. We'll give your patients ways to pay their bill online at myproviderlink.com after the visit. And we can automate and store and set them up for automated payment plans. BillFlash is your one-stop shop for patient billing and payment needs that will make it more likely that the patient is going to pay the bill for the services that you provided to them. And that's what's going to make your business more successful, more profitable, more able to continue providing the great medical care that you do to your patients. So with that said, we're wrapping up the presentation here. I think that we could open this up for questions. If there have been any questions as we've been going through the presentation, we'll have Jacqueline read those to me as we move on, but I want to give you a minute and encourage you that if you've heard anything that doesn't make sense, if you need a deeper discussion or a different insight, if you have a question about anything, please go to the questions module and go to webinar, type your question in there, and we would love to answer any of those that we can. So with that said, Jacqueline, do we have any questions that have come up so far?
No questions have been typed in, but feel free at this time to type in any questions that you may have so that way I can make sure that they are addressed by Tony.
Wonderful. And while we're waiting to see if any questions pop up, I will also let you know that if you look at the handout section of the GoToWebinar, you can grab and see the sample financial policy document that I had shared on the previous slide. It is attached right there for you, so you don't have to wait for us to send out our email later today or tomorrow that includes all of the information from the presentation. So if you'd like to grab that, you can do so right now on that link. So far, I'm not seeing any questions coming in. If we give everybody another 30 seconds or so to aggregate the questions, 30 seconds to a minute. If we have some come in, we'll answer them. If you have questions about any of the things that we talked about, we saw today, if you want to get a deeper understanding of how something might work and integrate into the workflows that you have, we have a great staff who's willing to talk to you in a consultative manner. We want to figure out how to make the tool work for you in your workflow and integrate it into the workflow that you have. So if you want to ask questions before you think about implementing or utilizing any of these things, you can reach out to us here. If you'd like to, if you are a new customer, this is not available for current BillFlash customers, but if you are a new BillFlash customer as a result of this, we can offer you what we would call a free trial where you only pay the price of a stamp, which allows you to send statements and e-bill notices through the text and email format for free for 30 days. The only fees that you would be incurring would be the cost of postage that each mailed statement would incur. So if these are things that are interesting to you, that you think could benefit your practice, reach out to us at the email address there, getpaid@billflash.com, or the phone number 435-940-9213. We also have pages on Facebook and LinkedIn. If you're there on social media and wanting to get more information from BillFlash, you can see us there.
Tony, a question did come in. The question
Okay.
is, statements are sent out and a patient pays on the statement after other charges have come in. Will the payment go directly to the statement charges or to the charges that are the furthest out?
That's a great question. So our job at BillFlash is to facilitate the payment. And when we integrate the payment records back into the practice management and EHR systems, what we are delivering to them is a notification that this patient made this payment. The payments made by patients are far different than payments made by insurance carriers. An insurance carrier pays for services on a line-by-line basis, transaction by transaction. Patients pay the whole bill or part of the bill. It's very rare. I'm not going to say it never happens because never and always are two very dangerous words, because every time I use them, somebody comes and tells me the exception where it exists. But generally speaking, patients don't have the right or capacity to go line by line and pay one line of their visit, but not the other line. They pay the statement, or they pay a portion of the statement, or they pay nothing. So what that means is that we deliver the payment notification back into the practice management system, or EHR, and then that system will either have an auto posting function that says we want it to automatically post to the newest, the oldest open, but it's all dependent on how those EHR or practice management systems integrate them back into their process. Most of them that I've seen, it brings them back into a queue where all you need to do, you don't need to enter the payment, you just need to link it to the charges that the patient, or that you would want to link it to. Does that make sense? Hopefully that does make sense. I guess you can't answer me other than just typing yes on the chat, but that's the approach and that's the way that we would see it. And if it's not integrated into your practice management system in a way where those payments are automatically feeding into it, they still show up in your bank account within 24 to 48 hours. And the way that you would manage posting those, if that integration is not there, is you would receive a report that's very similar to what you would get on a paper EOB from an insurance carrier, and then you'd go through and post it into your practice management system the same way. That's a great question. Thank you. Okay. I'm not seeing any other questions come in, Jacqueline.
Yeah, I don't see any other questions, but hopefully we were able to answer your question, Matthew. If you have any follow-up questions, feel free to reach out to us via email. We'd be more than happy to have that consultation with you.
All right, everybody. Thank you for your time today. If you have any other questions that you think of after this is done, reach out to us at the contact information that's up there on the screen. We will be sharing the PowerPoint slides and the handout with everybody who was in attendance today. We appreciate your time. We hope it was worth it. Let us know if there's anything that we can do to assist you in collecting from your patients. Have a great day, and we'll talk to you soon.